According to the World Health Organization, heart disease kills 3 times more people in high-income countries than any cancer. Here to explain to us how more than 75% of heart disease diagnoses could have been prevented is our guest, Dr. Joel Kahn. Dr. Kahn is a preventive cardiologist and clinical professor of medicine at Wayne State University School of Medicine in Michigan, and he is the author of 3 books, The No BS Diet, Dead Execs Don't Get Bonuses, and The Whole Heart Solution. He also writes the Holistic Heart Doc column for Reader's Digest magazine. Welcome, Dr. Kahn.
Thank you. So happy to be with you. It's a little noisy behind me. We'll explain why, but I'm full of great energy to talk today.
Good. Well, let's talk about your book. In your book, The Whole Heart Solution, you talk about the heart in a different way than I've heard it expressed before. You explain that the heart is more than just a pump. It's actually a type of brain, complete with its own set of neurons, hormones, and its own electrical field. Why is that important to understand?
Well, it both has to do with heart health, and it has to do in a greater scope with understanding people, relating to people. I mean, we all have that sense sometimes you walk in a room and before you even speak to a person, you've got some sense of resentment or anger or love or acceptance. It turns out there's a bunch of electromagnetic basis for some of those things. The brain does generate a field, an electrical field, but the heart's electrical field from the pumping and electricity inside the heart is 100 times stronger than the brain. And it does reach out outside the body. You can take recording equipment like we do on the skin called an electrocardiogram or EKG, which is already about 3 or 4 inches away from the heart. You can put it 3 or 4 feet away from the heart and record the electrical energy of the heart from a person, which means if you're standing within 4 or 5 feet of another person or a pet or something that also has a heartbeat and an energy field, those fields do interact. And there's some fascinating research that may be part of human interaction, human relationships. When you kind of lead with your heart, there may be a scientific basis for it. There's some amazing data that with a very simple breathing technique, you can sort of get your heart into its most efficient electrical properties. It's called coherence. And there's examples of people hugging their dogs, and the 2 heart rates start to synchronize with each other. In fact, if there's even a skip beat, they occur simultaneously when to each other. So that's just fascinating. Maybe more important is that we were taught in medical school about the role of the brain in supplying nervous supply to the heart. Nerves that come down and control the heart rate and the strength of contraction. Turns out there's actually more traffic going the other way. There's more traffic from the heart going up to the brain, sensing the strength of the heart, the blood flow to the heart, the endocrine or glandular system that's within the heart. So the heart is, call it the little brain. The heart has its own nervous system, and it explains a lot, and we can use it as a tool to be less stressed, stronger from an immune standpoint, lower our blood pressure. Yoga, meditation, all kind of rely on this, even it may not be explicit. Or you can go right for it and learn a couple simple techniques to kind of practice and use the heart's brain to optimize your life and performance.
That's amazing stuff. I had not heard any of that before. What are some of the other factors in play when you talk about what it takes to beat a heart? You've got an entire chapter on that. Can you tell us a little bit about that?
Yeah, it's really what we often call a whole network or a whole web. It takes healthy endocrine system, so that's your ovaries, your testes, your adrenal glands, your thyroid, your pituitary. If any of those are out of balance, it'll affect your heart system. It takes a healthy brain, just like it takes a healthy heart to supply a brain. It takes a healthy brain, so good brain health. Healthy lungs can clearly augment the use of the heart, and diseased lungs from smoking or occupation can terribly strain the heart. Now we're really learning how critical the GI tract is for heart health. And there's been an explosion of information in the last 3 years that a healthy bacterial population, healthy diet, directly impact your chance of heart health and heart disease. So these are all tied together, and we know that when you smoke, it affects multiple organs. When you eat healthy, it affects multiple organs. And so I'm a cardiologist, but I really should be called a bodyologist because it really affects everything.
Yeah, you have to look at every segment of the body to get a whole picture. Which, yeah, and so you've gone into a question that I was going to ask you a little later, but we can go into it now about the gut biome. What can we do to help promote better bacteria in our gut?
One is what to open. So we know that excess alcohol, not zero alcohol, but excess sugars, excess trans fats that the food industry has been adding to donuts, cookies, and cakes for so long.
Right.
The Crisco kind of things. And maybe excess fat in general. There's some data that eating high fatty foods may release bacterial toxins from your gut into your bloodstream, which is very bad for your heart and your whole body. Those would all be, somewhat damaging for sure. Probably pesticides, probably GMO-treated foods with glyphosate and such. There's pretty strong data they negatively impact the health of our bacterial content. On the other hand, organic foods, fermented foods in rich excess, probiotic drinks like kefir, or what I do, kombucha, because I don't do dairy, although there is coconut kefir. Certainly taking a prebiotic and probiotic, eating onions, garlic, asparagus, provide some nutrition to our healthy bacteria, so-called prebiotics. All these things are important, and it may be avoiding eggs and meat. Some of the hottest data out right now is that some of the amino acid content of eggs and meat can lead your gut to change the bacteria and produce a chemical in the bloodstream that's very bad for your arteries and your kidneys called TMAO. So when you really look at it, there's some strong data that a plant-based diet makes a better gut and makes a better heart. And we know that heart disease rates are lower in healthy plant-based eaters, and this may be part of the reason is a healthy GI tract.
And you're vegan as well, aren't you?
Yeah, for many decades I've been eating a healthy version of a plant-based vegan diet.
Oh, good. Because a vegan diet isn't necessarily healthy. It has to be a whole foods plant-based diet.
Right. I started cutting up my soy hot dogs and frying my soy bologna up because I used to fry regular bologna up, and a lot of transition over the time. And I'll occasionally enjoy a coney dog, a substitute that's sort of greasy and substandard, but that's a very rare day, although it's a fun day. Just have a big bowl of steamed broccoli with it.
Well, and Coca-Cola and French fries can technically be called vegan, but you can't thrive on that type of a diet. You really have to have all the nutritional properties intact.
Right.
You recommend some specialized tests beyond the typical test of blood screening and ECGs and treadmill tests. What are they? Why are they important? And who do you think should consider having these tests?
Right. And I think there's an important point, which is even a healthy plant-based diet is not a complete guarantee against heart disease, cancer. You don't skip your mammogram. You don't skip your colonoscopy. You don't get your prostate, you don't skip that check. If you're having chest pain, you don't assume that I can't be having heart disease. One, most of us probably were eating non-vegan before, and that may have caught up. Two, not all vegan diets are healthy. Three, there's genetic input. So I treat everybody with a passion to prevent heart disease in their heart and protect. We just had a very famous comedian pass away this week at age 66, Gary Shandling, of a heart attack. Never should happen. Never should happen. Never should happen. People say that's too strong a statement. And I don't know his history, and I don't know his family's history, and I'm not commenting on his medical care. But from my very advanced education, you can create a lifestyle and do advanced testing and get as close to saying you'll never have a heart attack as pretty much any situation in medicine. So yes, I do very advanced blood work that's available from commercial labs, usually covered by insurance, looking at nutrition, genetics, many factors other than just cholesterol that are in the blood. And it's very complex, but it's getting more interesting and more advanced every month. And I do imaging. If you want to know if you have heart disease, there's a couple of tests, cost you under a couple $100. One's an ultrasound of the neck, one's a CAT scan of the heart. And nobody should walk around saying, I don't know if I have heart disease. You might not like the news, but then there's a plan to improve upon that and probably reverse it. So I do a lot of heart disease reversal treatment in my clinic.
Do you still think that? Do you think that cholesterol is still an indicator of heart disease, though?
Yeah, I do. Now, there's worse kinds and better kinds, but high cholesterol is always a risk. And there's something called the LDL cholesterol, and even beyond that, the LDL particle number cholesterol. So I always do advanced tests. There's something called oxidized LDL. These are all worse and give you more information. But if your cholesterol is 300, it doesn't mean you're going to get heart disease, but you're statistically at greater risk, and I'm going to find out if your arteries are youthful or diseased. I let a few people walk around with a high cholesterol, but I've proven to the nth degree that their arteries are working at a youthful phase.
What do you consider to be a safe level?
Well, the safe level has to be combined with more testing. So, the safe level will be a high cholesterol with a low oxidized LDL, with a relatively low particle number, and proving that the arteries are anatomically clean and working normally. So it's a little process to go through before I'm going to let you walk around at 260, 270, 280. But I might, if I'm not going to treat your arteries with anything other than lifestyle if I've shown that your arteries are resisting. Because we do know there are some people that get to old age with a high cholesterol, but you're stacking the odds against you if you don't know for sure. Don't assume, that your cholesterol 300 is benign. You may be the next Gary Shanley, sadly.
I did not know that he passed. I'm sorry to hear that. I have a blood test coming up next month. It's actually been a couple of years since I've had them. What should I be asking her to check for?
You want to know about inflammation, so at a minimum you want high sensitivity C-reactive protein or HSCRP, a blood test. You want an advanced lipid profile, advanced cholesterol profile, give you the LDL particle number. That's you want to know your vitamin D level, your thyroid function. That's really, your blood sugar. Those are the bare minimums. But, if you're over 45 and you're concerned, maybe over 40, you want to find out which hospital in your area offers something called a heart calcium scan, a CT scan that takes about a minute, no injection, no iodine. In my community, it costs $75. It still requires a doctor's prescription. They may or may not be in favor of it, but if they're not, please buy and give them my book called Dead Executives Don't Get Bonuses, which lays out the academic and scientific support for it. And if you come out a happy zero, you're in pretty good shape. If you come out like patients I see every day with a score of 400, 600, 800, you've got old arteries. We got to jump all over that. Lifestyle, maybe some prescriptions, maybe some fitness, maybe some infrared sauna.
Is there any case in which you think that surgery and drugs are appropriate? Bypass
surgery, yeah, there are some. Usually, I'm an expert in stenting of the heart, and if you're in the emergency room actively having heart symptoms, either having or threatening to have a heart attack, you clearly can save your life with a stent or bypass. There may be no other recourse. But if you're the majority of people that maybe had some funny symptoms, maybe flunked the stress test mildly, nobody's ever going to talk to you about the opportunity to take an aspirin, radically change your diet and lifestyle, follow a Dr. Ornish or Dr. Esselstyn heart disease reversal program. If you're smart, you'll get on your smartphone and start Googling away and find people like me and Dr. Robert Osfeld in New York and Dr. Esselstyn at the Cleveland Clinic, Dr. Ornish, and many other good plant-strong, plant-educated cardiologists that will tell you, most people don't need that stent and that bypass and can safely try lifestyle change. But you got to be a serious student. There's no wimping, no whining. I'll smack you around if you're working on plant-based heart disease reversal and you tell me you're eating your french fries and your hamburger on your birthday. This is a serious but life-changing for the better approach to disease.
Well, I know from personal experience it works. And I also know from personal experiences that doctors are not always open to this. Years ago, and it must have been, goodness, it could have been 20 years ago, when I first discovered I had high blood pressure, I asked the doctor about lifestyle choices, and he said if you were going to change your diet, you would have already done it. And he just blew me off and gave me a prescription. And 12 years later, when I had some other medical issues, I had a doctor ligate my common bile duct and caused a whole lot of problems. But when I went plant-based, within 3 weeks I was off blood pressure medication. So I know how.
Oh, great!
And next month I'll be vegan for 5 years, and so I know how really well you can become on a vegan diet. And so I'm glad to see that more doctors are pushing that now.
Yeah, people just don't get told that it's a possibility to approach their adult diabetes, their blood pressure, their cholesterol, and their heart disease with a lifestyle, predominantly dietary change. And some will and some won't, but God knows, give them a chance. Give them some.
That's right. I was a perfect candidate for a lifestyle program, but he told me no, and at the time I just did what he said because we do what doctors say, but I've learned to question things now.
Question and read.
How does genetic inheritance affect our health outcomes?
It does, but you can test for it more and more, so it's not. But the general number is about 80% of current heart disease, adult diabetes, is lifestyle related, which is an awesomely scary and wonderful number. Because if you did the things wrong to get there, you can do the things right and go back.
Mm-hmm.
We are finding more and more you can reverse adult diabetes, even of long-standing change, with improved diet, lifestyle, sleep, don't smoke, on and on with heart disease too. So it's about 20 to 25%, and we can test. There's something called lipoprotein A, which is an inherited tendency to heart disease, and there's strategies to deal with it. There's something called ApoE that you can do routinely in the blood, strategies to deal with it. So you know your risk, and then you can gauge how much you want to completely grab onto lifestyle-related therapy, which I would urge everybody to grab completely onto anyways.
How does a sedentary lifestyle affect our heart function?
Sitting is the new cancer, sitting is the new smoking. Yeah, we're not farmers. We're not, in fact, we're not out there baling hay and all very much anymore. We have, even home-based jobs, office-based jobs. Every time I'm with a patient, I'm sitting for an hour, though I have a standing desk and I pop up as soon as they leave to write a note for 15 minutes. But it's affecting us. We burn less calories, our metabolism slows, our cholesterol goes the wrong way. So we have to build back in. Whether it is standing desks, treadmill desks, walking at lunch, walking at breakfast, taking the stairs, parking the car far away, 10 minutes 3 times a day of walking, stretching, all kinds of activities you can do at work. It could be I think there's a wonderful website by my friend, Dr. David Katz, who's Director of Preventive Medicine at Yale. And he created a bunch of exercises you could do at your desk in 5 minutes through the day. Activity Burst Exercise, that's what it is, ABE. And it's a free website with free short videos that anybody can use or install on their computer. If you Google it, you'll find it.
Okay, great. So where you're sitting right now is your new restaurant, and it's your son's restaurant, correct? You and your son together own it?
We're partners in crime. I would say grime at the end of the shift. We have to clean everything. But yeah, my son Daniel, 31 years old, and I co-founded a restaurant that took about 10 months to develop and opened 4 months ago in suburban Detroit. And
it's called GreenSpace Cafe?
That's right, GreenSpace Cafe in Ferndale, Michigan, and it's about 120-seat, completely plant-based, non-GMO, very high-quality eatery with a huge bar that's sitting in front of me as we speak. I'm sitting at a table in the lounge in the bar, and it's Friday. It's going to be crazy here tonight. There's often Friday and Saturday hour-and-a-half waits, 2-hour waits, even though we built a restaurant much larger than we thought. We were actually going to put in a lecture hall because we didn't think there was any way we'd fill it with clients, but to our surprise and delight, that's not the case. We have.
And that's, it looks amazing. I'm looking at your menu right now. This is a sample menu. You have tamale pie, a green curry bowl that just sounds marvelous. What is golden rose rice?
It's been altered a bit, but it's basmati rice with golden beets and
yum.
Turmeric. So very pretty color and very healthy.
You've got a rigatoni, pesto rigatoni, pad thai, kombucha something. I don't know what that means.
It's a Korean dish with sizzling rice and vegetables and Korean spices. It's delicious, very big seller.
It looks wonderful.
We have an oil-free menu for those that are following a heart disease reversal program. We have many gluten-free, soy-free, dairy. It's all dairy-free.
Mm-hmm.
And we have some low-sugar options. Our desserts are very health-oriented, and we have this gigantic bar with craft cocktails with organic liqueurs and raw juices and herbal infusions of turmeric and cardamom and peppercorns and bitters and all. So it's really a wonderful place that both the plant-based community and the omnivore community have flocked to as a nice alternative to another steakhouse in the area.
It looks absolutely.
Moving chairs around very noisily, but we love them.
Well, it looks really good. I'm looking at a farro lentil burger, forest mushroom tacos.
Yeah, those are crazy good. Yeah, those are organic corn tacos made right here in the restaurant.
Really? Oh my God, it looks so good. Root vegetables, Mediterranean flatbread. We're gonna Vegging Out and About is going to have to come up there and do
field trip.
Yeah, that's right. We need to do a restaurant review.
We'll happily welcome you, and you'll want to stay for at least a week.
Oh, well, we'll have to do that. Okay. You can find out about this restaurant at www.greenspacecafe.com, or you can call 248-206-7510. And I hope that our viewers in the area will certainly come by and check you out. Heart disease seems to really be a whole body solution. To further understand this and to do what you can do to improve your chances of living a long, healthy life, please go to Dr. Kahn's website, drjoelkahn.com, along with Dr. Kahn's books, The Whole Heart Solution, Dead Execs Don't Get Bonuses, and I am going to hold up a picture of your book, The Whole Heart Solution, which is a very good book, and it's full of good information. I'm sorry?
Thank you very much.
You don't happen to have copies of your other books with you, do you?
I do not. I apologize.
Dead Execs Don't Get Bonuses is really an eye-opener, and the No BS diet tells you what you should do and what you shouldn't do to have a healthy diet. You can also find a wealth of information on Dr. Kahn's website on diet, exercise, some collaborative programs he's involved in with other physicians, as well as numerous interesting articles that he's authored himself. His books can also be found on Amazon.com. Thank you so much for joining us. It's a pleasure, and I actually remembered to turn on my microphone this time, so I think we've got a very good video for our viewers to see.
Well, I appreciate it. It was as much fun the second time as it was the first time. I welcome any listeners or viewers to our fine restaurant, and I'd love to entertain you. You'll find my son, myself, my wife here most evenings. I do my cardiology practice during the day. And God bless you. We hope to see you soon.
Well, I certainly hope to get out there. Thank you so much, and hopefully we'll talk again the next time you write another book, because I sense that you're going to have other books in your future.
Yes. Thank you very much. You have a good day.